Compared to other states, Oklahoma consistently scores near the bottom when it comes to overall health and teen pregnancy rates. But one study ranks Oklahoma the very worst when it comes to women. It shows women in Oklahoma have the shortest lifespans in the nation. Doctors treating women say there are myriad reasons, but socioeconomic status and lifestyle are at the root of the state's high female mortality rate.
If it's not a clear sunny day, I can't get out. If it's raining, snowing, sleeting, whatever, I cannot get out.
Cheryl Cuddlemeyer's mother died of breast cancer at the age of 45. Her sister died of lung cancer at 44. Cheryl is 51.
I had a stroke back in '01, and my left side is paralyzed. That's why I'm in the chair. The chair is the only thing that lets me get out of the house.
She is still a smoker despite what her doctors told her.
The doctors attribute to the fact I smoke, and also because then I was on drugs and alcohol. I was like, well, I was working 3 jobs also, trying to support myself. And they said the stress and everything I was doing trying to relax was what was trying to kill me.
Smoking is just one of the risk factors revealed in a sobering report about women's health. A study by the University of Washington found the life expectancy of women in 48 Oklahoma counties is lower than it was 3 decades ago, and all Oklahoma women are living shorter lives than the national average. Nationally, the life expectancy for females is 80.8 years, up 2.4% since more than 30 years ago. But in Oklahoma, women are only expected to live 77.9 years, down 0.6% from 3 decades ago. Dr. Saisha Dennis is a family physician at the OU Tulsa Family Medicine Center. She serves those living in poverty.
The patients that I see universally are dealing with high blood pressure, diabetes. Most of my patients are overweight or obese.
Smoking is very bad, and it's very prevalent in our state, and it leads to lung cancer, COPD.
According to the New England Journal of Medicine, women who smoke are even more likely than men to die of lung cancer. Women smokers face a 17.8% greater risk of dying of lung cancer compared to 14.6% of men who smoke. And while smoking has led to many health problems among women, Dr. Susan Mehnert-Kay says one of the biggest health risks for women has to do with their diets.
Obesity, and all obesity-related problems like hypertension, diabetes, premature heart disease, premature arthritis, musculoskeletal complaints because they're too heavy, their back hurts, their knees hurt.
Patients in the waiting room of the Morton Health Clinic in Tulsa didn't want to do interviews, but off camera, several overweight middle-aged women said they were there because of heart problems. One young woman says she only takes her children to the doctor because she can't afford to go herself.
We have a large population that is just not covered by Medicaid. They make a little too much money to be covered by Medicaid, but not enough to be able to afford their medications. And they're just out of luck at this point and alone.
Dr. Moserrat Abadi Soleil says she just saw a 57-year-old female patient who will die early, most likely from a heart attack due to diabetes.
Today we had a patient, we had a long talk about her insulin. She has diabetes. She comes in once a year because she can't afford the visits. Her blood sugars are completely out of control, but she can't afford the insulin.
My opinion is that, expanding Medicaid for my patient population would make a difference. I have a lot of patients who fell into that gap where they couldn't apply or couldn't get access to the exchange, and they don't qualify for Medicaid.
During a one-day spring event at the Morton Clinic, more than 300 people showed up to sign up for insurance under the Affordable Care Act, but some found their efforts were futile.
We assisted 309 people. We actually enrolled 50 in health insurance, and I know that sounds pretty low, but we have had a lot of folks who came here who wanted insurance who are below the poverty level. And if you're below the poverty level in Oklahoma, you don't get assistance in paying for the insurance.
Insurance consultant Teresa Ingram is also telling many would-be clients they aren't eligible.
I'd say the majority of people that I've dealt with are 300% of the federal poverty level and below. And I see a whole lot of people, more people than I wish I saw at the below 100% of the federal poverty level, people that, we say fell into a crater. They get no help from anyone.
But even those like Cheryl, who does qualify for Medicaid and/or Medicare, find coverage lacking.
Do you go to the doctor for preventive health care?
I try to, but a lot of preventive tests they don't cover under Medicare and Medicaid, and which is a hindrance, so I don't get it done as often as I should.
While some women, especially the working poor, face roadblocks to better health, Dr. Mehnert-Kay believes many women could increase their longevity by taking some personal responsibility for their health.
What are your, being honest with yourself about your diet? How many calories are you drinking a day? Just drinking in your soda and your tea and your fruit juice, whatever. How many empty calories are you drinking every day? How much fast food are you eating? How many days a week do you eat out? Because your portion control is horrible if you're eating out. It's 80% of its diet. I wish it was the other way around. I wish it was 80% exercise. That would be easier to control.
Unless Oklahomans start slimming down, it's estimated obesity-related health care costs in Oklahoma could increase nearly 11% in just 16 years.